Hi everyone, in this 1 minute CME presentation, we are going to see about the role of benfotiamine in diabetic nephropathy. As we all know, diabetic nephropathy is one of the common complications of chronic diabetes. 25% of the newly diagnosed type 2 diabetes mellitus patients, over the next 10 years, they will develop nephropathic changes. So this is a common cause for the end-stage renal disease, and this also contributes to the cardiovascular mortality and morbidity in diabetes mellitus patients. So in chronic diabetes, both the metabolic changes and hemodynamic changes along with increased reactive oxygen species all could contribute to the reduced renal function. The benfotiamine's role of diabetic nephropathy is in detail discussed by Dr. Rabbani in this review article. So he is proposing the following points. So why he thinks that benfotiamine could be beneficial in diabetic nephropathy. So one is the metabolism and clearance of thiamine is altered in type 2 diabetes mellitus, and there is reduced thiamine circulating concentration, and tissue specific thiamine also there is a deficiency, and along with that there is a decreased activity and expression of thiamine dependent transketolase, especially in renal glomeruli. So all these things make the reviewer to think about the role of benfotiamine in prevention and treatment of diabetic nephropathy. So based on this evidence, there are two clinical randomized controlled trials which were done. So one is where they gave 300 milligram of thiamine per day for 3 months. So this has led to significant reduction in the urine albumin excretion. So they also proposed that this benfotiamine administration can reverse this microalbuminuria, a early manifestation of nephropathy. And these changes were correlated with the increase in plasma thiamine concentration. So there is another clinical trial, so where they have used still higher dose, 900 milligram per day for 3 months. So in this study, they could find that there is a significant increase in the thiamine concentration, but they found that there is a reduction in urine albumin excretion over the observation period, but they could not meet the statistical significance. But still they discussed that this reduction can be a beneficial effect in people with diabetic nephropathy. So all these facts direct to the point that the benfotiamine administration in diabetes patients, so it can definitely help in diabetic nephropathy.